Dr. Margarita Loeza. I'm a family medicine doctor, and I'm the Assistant Dean of Admissions and Student Affairs in the College of Medicine at CDU. When I talk to patients about vaccines and I try to set the tone, I think it's really important, is it the first time I'm meeting the patient or is it a long-standing patient? It is really different. I think one of the things I try to remember is to sit down and not be rushed and try to remember what it was like when I took my son to get vaccines and I was so stressed about it. But I think I just talk to people, answer their questions, try to meet them where they're at, and try to bargain to get, because I know it's the right thing to do for the child or the patient. I think the long history of vaccines make them feel routine or not optional. It is that they're part of the well-child exams and the schedules and the guidelines provided by many, many societies. And so, if you're getting your 2-month vaccines and you tell the mom and the dad or whoever's bringing the child, we're going to see you in 2 months for the next set. And you have a little card, a little yellow card, and you see the blanks, and the goal is to fill out the card so they could start kindergarten or, go to high school or whatever the case may be. I think healthcare providers can, continue to be respectful and, respect patient autonomy, first by listening and trying to answer questions. But I could see where people are frustrated and providers are frustrated and you feel rushed, but if you could just take some time and sit and talk to the person and listen and try to understand why they're scared and try to remember that they're just scared. But I think also patients need to remember that doctors are facing a lot of stress right now and that we really in our hearts know and feel that we're doing the right thing and we want to prevent illness because it's easier. So I think that we need to both listen to each other. So healthcare providers can respect autonomy, remain respectful and confident. And doctors right now are under a lot of pressure. We know and feel that we're doing the right thing and we want to prevent disease. And we are combating a lot of negative press, social media, and we're under time restriction. Things are changing. And when a doctor used to be a very trusted person and we could just say, we recommend this, and the patient would say, sure. I think that we need to listen to each other, and I think that patients need to understand that doctors aren't making money off vaccines. If anything, a doctor that has a private clinic and is buying vaccines, they're losing money on vaccines. And that they're actually, it's really important to us to immunize people because over the years we've seen what immunizations do and we want to save lives, and that's why we went into it. So I think that right now our healthcare providers are burning out, but understandably I think patients should be allowed to always ask questions and that we all need to listen to each other because at the end of the day we're trying to do what's best for patients. My recommendation to immunize patients have made a difference, but I think it's kind of like in a population base or in the long run. So I worked for many years at a teen clinic where, students in California are allowed to get HPV vaccines without parental consent. And I gave out as many as I could. And over the years, you watch the stats of cervical cancer going down. And I think that I was able to show students pictures, male and female students, of what HPV causes, warts, cervical cancer, penile cancer. And I was able to convince a group. I'll probably not know for many years, but it's, what I did, but I know from population health that as a group, doctors are reducing the number of cervical cancer and genital warts, or we're preventing tetanus. I think I saw when I was a young doctor, I was like an intern in the 90s, and I saw a woman die of tetany. She had tetanus and didn't have her tetanus vaccine, and they had us all come and see her, and she had lockjaw, and she was dying, and there was nothing we could do. But one thing I never forgot to do is to offer a patient a tetanus shot. So I think that it's hard to quantify your impact, but the more people we immunize, the more people we protect.